Welcome to EPG Pathshala on the subject Social Medicine and Community Health. I am Professor C.P. Mishra, working in the Department of Community Medicine, Institute of Medical Sciences, Manas Hindu University, Varanasi. I shall be discussing the module Non-Governmental Organizations in Healthcare. This module belongs to the paper Healthcare Delivery System. The module Non-Governmental Organizations in Healthcare has been developed by a team comprising of myself as principal investigator, Professor Nazam Khalik from the Department of Community Medicine, Jawaharlal Nehru Medical College, Aligarh Muslim University, Aligarh, as paper coordinator. The module has been written by Dr. Rufi from the Department of Community Medicine, Jawaharlal Nehru Medical College, Aligarh Muslim University, Aligarh, and the content has been reviewed by Dr. Uzma Iram from the Department of Community Medicine, Jawaharlal Nehru Medical College, Aligarh Muslim University, Aligarh. The learning objectives that has been set for this module is: number one, to understand differences between non-governmental and governmental and voluntary organizations, to know about various types of non-governmental organizations working in the field of health, to understand the contribution of these agencies in delivering of health services in India. The concept of voluntary action is very ancient. It is not a new phenomenon. During disasters, during emergencies, many voluntary actions used to take place. In the early years of 19th century, voluntary agencies provided services to the underprivileged and weaker sections of the society, largely in the field of religion and social reforms. In the early decades of 20th century, provided services besides relief and rehabilitation programs in times of natural calamities, also in other fields like education, health, and labor force. The government undertook welfare schemes under various plans and policies. Later on, the idea was that we can consider the programs running through the government as railway tracks. They have a different system of running the program, and NGOs have more wider penetration, and therefore the complementary action of both are desired in order to run a particular program in any country, and more so in particularly in India, where a lot of geographical, cultural, economic, social variations exist. During the latter half of the 1970s, community organizations gained momentum. From the mid-1980s, a further trend emerged within the NGO movement, emphasizing the importance of professional approach based on sound management, planning, and coordination. The 9th planning message involving NGOs right from the planning process. That was a first major plan when it was envisaged that NGOs should be involved in the system right from the beginning. Non-governmental organizations, by definition, a non-governmental organization is any organization that does not include any government or government-appointed representative in their membership. Voluntary organizations. A voluntary organization is an organization that uses the human resources of volunteers for achieving its main purpose. NGO in India, although a systematic documentation of NGOs' contribution is lacking, it is obvious that NGOs and non-profit institutions could improve access, quality and equity of services either through direct provision or through advocacy and other actions. The challenge is to find strategies that will facilitate a far more substantial participation in the health sector, particularly in poor performing states and remote areas, and to ensure a system that will keep participation accountable and transparent. So NGO involvement in health sector is a welcome decision. But there are certain issues that should be taken into cognizance. Number one, their actions should be complementary. Whatever things are being done by the government system, that should not be duplicated. What is required that where government machinery is not able to reach, or where government machinery is not able to give optimum dividends, their non-governmental organizations can reach there and provide the services, particularly in the remote areas or inaccessible areas or in poor performing states. And since they are being brought into the system, their participation is key to success, but there must be a strong element of transparency in financial issues and accountability for work. NGOs and healthcare services in India. NGOs provide healthcare to 5% of Indian population. This is a very less population. This has to be increased. NGOs are funded by government, by donor agencies, by community, and by self-generated funds and contribution made by the community, as well as local efforts made by the voluntary organization. Main sources within the category of community and self-financial organizations with many innovative financial mechanisms, progressive fee scale, community-based prepayment insurance schemes, and income generating schemes. Voluntary Health Scheme Madras, providing health services to low-income people in urban areas. Private sectors also enabled a tie-up with the government insurance companies working for financing healthcare. The Seba Cooperative Health Society in Kolkata, Apollo Hospital Group in Hyderabad, Madras, and so on. So this is an activity going on through Aparajita Voluntary Health Association of India scheme. Only a few NGOs operating in India and providing a wide range of health services. They were more active in the areas of preventive and promotive health care. Their contribution to community health care was also more substantial. The fact that several of these NGOs run dispensaries, clinics, and hospitals, indicating scope to encourage and expand the role of non-governmental organizations in the provision of curative health care. The idea is that integrated services in terms of which is a combination of preventive, promotive, and curative care should be provided, and it would be ideal that these services be prioritized to the vulnerable group, but emphasis should be on the provision of services from home to home, so that a comprehensive health care is provided by them. The government has realized early that non-governmental organizations could be complementary to provide health care services. This realization is very important because we can't reach to each and every one person by the system we are doing our work, and therefore NGOs complementary action is desired. One of the encouraging facts of this movement has been the cooperation and helps extended by many NGOs by the government. The government promotes NGOs in health sector for two main reasons: to train its functionaries and to implement its program in healthcare delivery. So one is the capacity building of the staff, and second is to implement its program, particularly in difficult areas. The Child in Need Institute, Kolkata, and Seva are its example. Goes to ensure social justice, equity, and human rights in the provision and distribution of health services to all, with emphasis on the less privileged millions, and to promote and strengthen a medically rational, culturally acceptable, and economically sustainable health system in the country, to develop sustainable and innovative strategies to ensure health and overall community development in remote and vulnerable areas through various grassroots level initiatives, and to provide relief and rehabilitation in areas affected by disasters and calamities and help the affected and rebuild a better life for themselves. So not only relief, not only providing initial care, but they can also play a very substantial role in development of those areas which has been will be affected by disasters. So rescue, relief and rehabilitation, these are the three important areas where they should be involved. PATH is another NGO which has made significant input in provision of healthcare, particularly in terms of health policy research and policy interventions for a cost-effective, promotive and preventive healthcare system. Such research, health policy research and policy interventions are key elements in achieving national health targets. Second important aspect that was taken care by PATH has been advocacy and lobbying with policymakers on important issues. Because in order to generate political will in a country, there should be advocacy and lobbying for a particular intervention that will make a significant impact on the health of the people of India or any country. So advocacy, health policy research and policy interventions that are cost effective, in these dimensions PATH has contributed immensely. Supporting voluntary efforts through formation and strengthening of similar developmental initiatives is another important dimension. Initiating sustainable health and development programs at grassroots level. Many times, many initiatives are taken up, but their sustainability issues are not addressed. And therefore, as long as the NGO is working in that particular area, the things moves and then it stops. So therefore, every effort should be made that the programs in which either by government sector or by non-governmental organizations, once implemented in a particular area, if they have working on in a project mode, there should be a strong element of sustainability. Once the program is taken back, then the people themselves can, or the system itself can take care of. Developing communication strategies aimed at promoting campaigns and health education. This has been a very missing point in all the government programs, although government was conscious very much that health education, information education communication or behavioral change communication, whatever we call, has a significant impact on the health of the people. And therefore, developing communication strategies is important. And non-governmental organizations can play a very significant role in devising communication strategies, in devising behavioral change communication strategies, BCC strategies, and bringing out changes at the grassroots level by motivating people. A creation of awareness as well and provision of counseling services can be undertaken by these organizations. Dissemination of information to a wide range of audience. Though, if you look at the different approaches to health education, one is mass media, another is person-to-person communication, another is group activity. Mass media has the potential of reaching to each and every person, but there is no element of interpersonal discussions. The community has many inherent questions that has to be addressed before a behavioral change in terms of health provision or acceptance of a particular health measure is undertaken. And therefore, the dissemination of information to a wide range of audience must be envisaged in a manner that takes into cognizance the health, human resource, and other related sector resources for wider dissemination of information, and with the ultimate purpose of making a change in behavior of the people for positive change. Effective networking with government, United Nations, and voluntary organizations. Networking is important because without networking, if government sector operates separately, non-governmental organization sections operate separately, there will be a duplication of efforts, there will be wastage of resources, and probably the additive or probably the complementary effect of activities by government and NGOs will be not visible. Responding to disasters and calamities. This is an important area where NGOs can prepare a contingency plan and start measures at the earliest. In disasters, time is essence. Time is essence in public health as a whole, and more so in particular in disasters and calamities. The vision is making health a reality for the people of India. Health has been a dream. Maybe Government of India has expanded a very large health infrastructure in our country, but functionality part is questionable because most of the people are still utilizing private sector, particularly for community care, and our efforts in preventive community care needs to be geared up, and that can be done through voluntary organizations. Mission is promotion of social justice, equity, and human rights in the provision and distribution of health services for all, with emphasis on the less privileged sections. This should not remain only promise. If you have to fulfill our promises, then there should be strategies, there should be performance audit, and midterm corrections be taken so that we can ensure social justice. We can ensure equity and human rights in provision of health services. To promote and strengthen a medically rational, culturally acceptable, and economically sustainable healthcare system in the country. India has a diverse type of practices related to health. Ayush system is there, then other traditional systems are there prevailing in the country, which are well tested, which are well accepted by the people. So these should not work in isolation. There should be integration of these systems for optimum benefits. To develop sustainable and innovative strategies to ensure health and overall community development in remote, vulnerable, and poorest areas through the Ngos and PACS projects. To provide relief and rehabilitation in areas affected by disasters, calamities, and help the affected rebuild a better life from themselves. So we have to move from disasters to development. That should be a concept. And probably no other organization than a non-governmental organization can play a very significant role in this direction. Policy interventions, knowledge development, and advocacy can be done at international level and national level. And community level actions there are many examples like Ngos project, like Aparajita project in Odisha, Aparajita Andaman, and so on. So there are many projects, NGOs which are working at the village grassroots level, but there are many non-governmental organizations which can play a very significant role at international level and national level in policy interventions, in advocacy, and so on. Aparajita Odisha, an example is that a very strong element of community participation is there. In disaster response and management, Aparajita Andaman is an example. We have Jammu Kashmir Voluntary Health Association contributions, for example. Communicable disease prevention, GFATM, Access project for TB prevention, malaria control and cholera elimination among vulnerable communities, malaria control, IMCP second. These are some of the examples where NGO have made us. GFATM, Access project for TB prevention, but this is a community level action going on for staff capacity building. Come together for a good cause, Indian Red Cross Society. There are two types of agencies, particularly non-governmental organizations, working in the field of national agencies, working in the field of MCH, working for a specific disease problem, working for general health care and professional bodies. So, the national agencies can be grouped into four ways. And international NGOs are multilateral agencies, UN agencies, bilateral single government agencies, and non-governmental organizations. World AIDS Day is an activity taken by a professional group like IMA, and so many professional bodies like IMA, Indian Academy of Pediatrics, Indian Institute of Preventive and Social Medicine, Indian Public Health Associations, they are contributing a lot in the development of national development. Some of the well-known non-governmental organizations in India and who have contributed immensely for the development of health services in India are Indian Red Cross Society, Hind Kust Nivaran Sangh, Indian Council for Child Welfare, Tuberculosis Association of India and institutions under Tuberculosis Association of India, Central Social Welfare Board, the All India Blind Relief Society, number of professional bodies like Indian Academy of Pediatrics, like Indian Institute of Preventive and Social Medicine, like Indian Public Health Association, and one of the largest private sector bodies, Indian Medical Association. A number of international agencies are there. We are contributing for the immense growth of India's, and not only in India, in many other countries. Now, coming to the various contributions, particularly of the United Nations and other organizations, World Health Organization has made a very significant impact, and this World Health Organization is a specialized non-political agency, health agency of United Nations, with its headquarters in Geneva. This World Health Organization was established in the year 1946, and Technical Preparatory Committee, which was chaired by Rensand, approved first time in the International Conference of 51 Nations, which was a commission which was held at New York. The basic premise of WHO is that each and every person in the world should have attainment the highest level of health that will permit them to lead a socially and economically productive life. WHO has performed many functions like prevention and control of specific diseases, development of comprehensive health services, which talks of curative, preventive, promotive and rehabilitative services from home to tomb. It emphasized on family health. It emphasized on promotion of environmental health. Also made emphasis on health statistics, that is health information system, global health statistics and biomedical research, and cooperation with other organizations. Similarly, Unicef is another organization which has contributed immensely to different countries of the world in the area of child health, maternal health. The Rockefeller Foundation, a philanthropic organization that was established in 1913, was endowed by Mr. John D. Rockefeller with the dual goals of building greater resilience, helping people, communities, and institutions prepare to withstand and emerge stronger from the acute shocks and chronic stresses, and advancing more inclusive economies and expand effective formative, broadly shared prosperity. CARE is another international organization, particularly it was founded in North America in 1945. The projects are integrating nutrition and health project. So it has worked basically in the areas of nutrition and in some health projects, better health and nutrition project, anemia control project, improving women's health project, and improving health care for adults and girls project, and child survival project, improving women's reproductive health and family planning projects. Ford Foundation is another project, important international organization, with headquarters in New York, and which was created in the year long back in 1936. And it supports many projects that focus on reducing poverty, injustice, promoting democratic values, advancing human knowledge, creativity and achievement. It also encourages orientation training courses, training cum action projects, pilot project in rural health services, and establishment of National Institute of Health Administration Education, Calcutta, under water and drainage system scheme and family planning programs. A number of measures have been taken. There are other organizations like Unicef. Besides Unicef, I have discussed earlier, UNDP, UNFPA, World Bank, USAID, the Colombo Plan, SIDA, DANIDA, and so on, which are contributing immensely, non-government, though they are not a governmental body, they are contributing bilateral agencies, unilateral agencies, UN agencies, which are contributing for the well-being of the health and people of the India. So just to summarize, voluntary organizations are NGOs. There are some differences, but they are used interchangeably, are not a new phenomenon. The concept of voluntary action is very ancient. The voluntary health agencies or NGOs occupy an important place in community health programs. Voluntary Health Association of India is serving people of India with a goal of making health a reality for the people of India. The main types of voluntary health agencies are national agencies working in the field of MCH, working for specific disease problems, working for general health care, professional bodies, and a number of international organizations and multilateral organizations, bilateral or single government organizations and non-governmental organizations are there. Their functions are various fields of health, and they are providing important inputs in the various fields of health services. Thank you very much for visiting EPG Pathshala on the subject non-governmental organizations and their role in provision of healthcare in India. Thank you.